Comprehensive molecular characterization of papillary renal cell carcinoma. Definition: papillary renal cell carcinoma, which accounts for 50 to 20% of kidney cancer, is a heterogeneous disease with histologic subtypes and variations in both disease progressions and patient outcomes. Papillary renal cell carcinoma has two main subtypes, type 1 and type 2. Applications in medicine. Much of our prior knowledge of genetic basics of papillary renal cell carcinoma is based on the study of inherited papillary renal cell carcinoma. Hereditary papillary renal cell carcinoma, a rare disorder presenting with an increased risk of type 1 disease, is characterized by activating germinal mutations of the MET gene. Somatic MET gene mutations are found in 13 to 15% of non-hereditary papillary cell carcinoma. These aggressive tumors are characterized by increases of oxidative stress and activation of the NRF2 antioxidant response element pathway.
Traction images are going to be vital in terms of identifying that rather subtle enhancement. Now, papillary RCCs tend to have low levels of enhancement. They're often going to be T2 hypointense, and I think that MR can be a great modality for identifying these lesions. I have several examples where it's hard to really appreciate definite enhancement on the CT scan, but the post-gadolinium subtraction images on MR really allow you to make the right diagnosis.
Pros and cons. In this trial, we made an integrative genomic analysis of 161 papillary renal cell carcinoma tumors to provide molecular insights into tumor classification and for clinical recommendations and suggest paths to the developing of mechanism-based therapies. This classification of papillary renal cell carcinoma could potentially have a substantial effect on clinical and therapeutic management and on the designs of clinical trials. This study suggests that gene fusions involving TFE3 or TFEB are unappreciated in type 2 tumors in adults and should be considered in any patient with type 2 disease. Also, papillary renal cell carcinoma with fusions involving TFE3 or TFBB are generally considered to be diseases of children and young adults.
For papillary cancer, for renal cell carcinoma, so there are two types. One is papillary type 1, the other one is called type 2. So type 1 actually has a higher frequency of a gene mutation. It's called MET mutation. So Dr. Shrari actually did a clinical trial with a MET inhibitor that showed some modest activity. But that c-MET inhibitor, according to his talk today, it's not a very pure inhibitor. So right now, I think they are planning to do another more pure MET inhibitor, and hopefully, this new MET inhibitor can have more clinical activity in relying on drugs that are for the common clear cell carcinoma to treat these rare types of tumor. But clearly they have different drivers of gene mutation for this rare type of kidney cancer. So by using one class drug on another class or other classes of tumors, that may work well. So I think as long as we track the biology of this rare kidney cancer and design drugs to target these changes, the hope will be higher in the future. So I think for clear cell renal cell carcinoma, I think the future is bright. So we already have quite a few drugs available for this common type of cancer. For rare tumors, they are getting more and more attention from the oncology field. And once the drug companies figure out, these agents can be, especially these immunotherapy agents, can be used for the common kidney cancer. And once they are approved by the FDA, it's very possible that they can be used for this rare kidney cancer, because immunotherapy normally activates the immune system to attack cancer. So it doesn't care about which type of cancer it is. So I think from this standpoint, I think the future for this non-common kidney cancer is also brighter than before.
Issue applied in Ecuador. Worldwide, the incidence of renal cell carcinoma behaves heterogeneously. In the United States, there are approximately 63,000 new cases and 14,000 deaths for almost every year. In Ecuador, we have a cumulative prevalence or report of 90.66 in 5 years for every 100,000 inhabitants, in both sexes ranking fifth. Conclusions. Type 1 and type 2 papillary renal cell carcinoma were shown to be clinically and biologically distant. Alterations in the MET pathway were associated with type 1, and activation of NRF2 ARE pathway was associated with type 2. CDKN2A loss and CIMP in type 2 conveyed a poor prognosis. Furthermore, type 2 papillary renal cell carcinoma consisted of at least 3 subtypes based on molecular and phenotypic factors.
To better understand papillary RCC, what you have to understand is the big picture. And so overall, out of 100 renal cell carcinoma, 80 will be clear cell. We're not talking about this one, we're talking about the 20 left. And 15 of these 20 left will likely to be what we call papillary renal cell carcinoma. And it's based on the morphology, how it looks like when you look at the tumor with a microscope. And within this family of papillary renal cell carcinoma, there are usually 2 entities that are what we call the type 1, which tend to be rather smaller tumors, more localized to the kidney, or what we call the type 2, that can evolve more rapidly to metastatic disease. So these are a kind of renal carcinoma. There is no specific risk factor for this subtype, so we stay on the field of age 60 with known risk factors as hypertension or obesity, overweight. The thing is, we do also know that there are some inherited syndrome that does exist, and we can have that with papillary renal cell carcinoma. So there is some inherited syndrome with that kind of tumor. But what we do know is that for the first part of these papillary renal cell carcinoma, which are the type 1s, it's very like MET. It's a gene that codes for a protein that is on the membrane of tumor cells. Is very important because we know that it can be mutated, and so it means activated. And MET appears as a relevant biological parameters in that kind of type 1 papillary renal cell carcinoma, and it may play a role as well in few type 2. PRCC, as all non-clear cell, has no specific therapy available. We use by analogy with what we do with clear cell renal cell carcinoma, and the guidelines always state that patients should be referred to clinical trial so that we could try to better investigate these disease and offer new therapy and all what the clinical trial brings to the patients in terms of accessing new compounds, because the results with the available agents that are approved are quite disappointing so far. MET, it's a gene that codes for a protein that is on the membrane of tumor cells, is very important because we know that it can be mutated, and so it means activated. And MET appears as a relevant biological parameters in that kind of type 1 papillary renal cell carcinoma, and it may play a role as well in few type 2. PRCC, as all non-clear cell, has no specific therapy available. We use by analogy with what we do with clear cell renal cell carcinoma, and the guidelines always state that patients should be referred to clinical trial so that we could try to better investigate these disease and offer new therapy and all what the clinical trial brings to the patients in terms of accessing new compounds, because the results with the available agents that are approved are quite disappointing so far.